Hi, everybody. Thank you for being here today with me. I'm Boris Chapeton. I am a researcher at Jean Monnet University in France. And I would like today to see with you if governments and mass media are on a level playing field when it comes to communicate. So before starting anything, we might rewind a bit on the situation to be sure that we are all on the same page. So once upon a time, we were living our lives and heard of a flu that was spreading here and there. We were told that it was a bad flu, and we had to pay attention to the coronavirus. Some were advising to wear a mask to protect ourselves against this bad flu and to keep our distance from each other as much as we can, while keep going to work. Then, actually, no. We have been told that wearing a mask was asking specific skills and that not using it correctly could be worse. So we should not worry about wearing a mask, but rather keep our distances from each other and stay at home when feeling sick. Meanwhile, while the world was discovering what a pangolin was, the number of COVID-19 cases were increasingly being reported worldwide. And some countries were even talking about closing their borders in an attempt to maintain the spread of the virus and the number of deaths due to a lack of treatment. We were now living in a pandemic time, and everyone should know about it. Something big was happening. Then, in this dark and particular time, someone arrived, Professor Raoult. Professor Raoult, in charge of the infectious disease department of the Mediterranean University and Hospital in France, told us that he had a solution, the chloroquine. It was an old tablet which was used for decades and that was immediately available and cheap to produce. Imagine a professor who is known by his peers to have an unusual way of thinking and who doesn't look like most of the scientists would have the solution. More, imagine. The solution to the global pandemic was here and now, and it was coming from France. You can then imagine how everybody in France heard about it and how it was discussed on most of the media. Yet, while people were starting to hope for the best, the French government and the Ministry of Health told us to be careful, that they were paying attention to the results associated to the use of the hydroxychloroquine, but that they ordered more trials before agreeing to its use within a public health perspective. Adding to that, the pharmaceutical industry Sanofi, which is producing the tablets, agreed with the government, and while saying that indeed we had to pay attention, they were also saying that they were ready to help the government and the researchers it needed, and that they were concentrating their efforts into a vaccine, that it was their number one priority. Waiting for that and the other results, and because the hospitals were getting under pressure, the government took the decision to install a national lockdown. In parallel, some French mayors were advising to follow Professor Raoult's expertise to use the hydroxychloroquine within this emergency situation. If people wanted to have the tablets and run the tests, they were encouraged to come to the hospital of their city, contradicting the government's recommendation. And be sure that it has been heard by the population, who also got to learn that the army ordered on its side a stock of hydroxychloroquine to China in a preventive way, if health authorities were to agree their use to fight COVID-19. While everybody was wondering what was going on, the government was preparing the bust lockdown that would be with a mask, because actually the mask is proven to be effective. And if we are totally honest, until now, there was not enough mask for everyone, so it couldn't have been recommended to wear it. But now it was fine. Many masks were ordered and more were to come. But everybody did not have to wear a mask all the time and everywhere. It was depending on your age, work, and other particular conditions, because There was perhaps as well a natural immunity that was being developed. That was at least what was happening in other countries. And still, if possible, it was preferable for people to keep working and staying at home. Anyway, children could not go back to school straight away neither. But that's another story. Now that a lot of people were back to work, it was time to think about what the holidays will look like and to give a bit of hope to the people. Because most of the borders were closed and the COVID-19 was still spreading here and there, they would be French anyway. And it was a good thing because we needed to invest into the French economy that got really bad. It was also the time to think about the situation. The virus was still existing, but we had masks. Because we had masks, we could go back to work and earn a living again. It was important to buy again to bring the economy up. Regarding the COVID, people were dying from it, but much less than cancer and many different other diseases. As well, some people had COVID, but they got better. And now, moreover, someone came back with more proof that what he was asserting since the beginning was true. Patients receiving hydroxychloroquine were getting better and were not dying. He was also saying that in Marseille, where he was living, far away from the capital, where the elite and the decisions are being taken, the virus was practically gone. The world needed to know then that the treatment was indeed working. But no, it's not what happened. And I'm going to stop here now because if anyone managed to find any logic in all that I have said, do not hesitate to raise your hand because I am still trying to make sense myself and I'm still confused with all the information that we are being provided with. And this is maybe the problem. We are having too many information coming from all over the place, bringing confusion to the message. The communication that the media made about the COVID-19 is really noisy. They are sharing many information with more or less accuracy and from different sources who have more or less real knowledge about the pandemic, but who are full of opinions. When looking at the official communication made by the government, is not assertive. They are more trying to reassure the population than alerting about what was going on, and maybe because they didn't know much more about the virus than that was shared by the media. But whereas they were trying to reassure the population, first by saying that it was a bad flu, they were also hiding the fact that we were not prepared to face such a pandemic. They knew we were missing masks and maybe they didn't want to react too fast, not to reproduce the mistakes that have been made during the H1N1 pandemic, when a lot of vaccines have been ordered in vain, costing millions of euros for nothing, because very, very few asked for it, and because the pandemic has been proven to be actually not that bad at the time. So we have a population that is being alerted of a danger and who is asked to comply to a message that is blurred and hard to get. Even now, does anybody know clearly what is the message that the population need to get and on which purpose? Because this is also a challenge, getting to know why the population should comply to whatever message that is being sent. If the message is to encourage the population to adopt the physical distancing rules, to wear a mask and/or other, it needs to make sense. When looking at the characteristics of innovation, as described by Rogers, we can try to see if the population would be more likely or not to follow the preventive strategies in order to beat the spread of the virus while living our lives. And I'm afraid that we miss some points. What is the population gaining of adopting the preventive rules? Do they get better? Does it match their values? Does it make sense? Now that we are in a second lockdown in France, could we consider that the first one really paid off? If we look at the results from the survey made by Public Health France, we can doubt that any of the previous questions have found a positive response to them. We can observe that although the French population wear more and more the masks, it's really hard for them to adopt the other preventive measures, as keeping the distance to at least 1 meter away from each other, avoiding the gathering or face-to-face meeting, and so on. As well, we can observe that it seems to be hard for the French population to perceive the COVID as being a serious disease and to feel vulnerable to it. Regarding the protective barriers, it's the same. It seems to be harder and harder for the population to make any sense of them and their use. And think about, what would people consider first? Their own good or the social good? Would they find more benefits or more costs within what they are being asked to do? If we want to wait within the decision process, we have to consider many variables that interplay within the decision-making process of each individual. However, in this emergency time that does not make sense, what should we focus on? Educating the population and trying to make them understand a situation that does not make any sense at the moment, or encouraging them to comply with recommendations that are being taken for the social good? And how do we do it? If we want to share a relative knowledge, then we would better communicate through the usual tools offered by the mass media. However, if we want to accentuate the information that we want to share into a persuasive dynamic, then we better use interpersonal channels and spread the message through leaders, peers, and other figures in general that are associated to trust, desirability, authority, or other, so that an identification will be created between the population and the messenger. And I believe that governments understood that, as we can see that in some countries, in order to reach the young population, governments have tried to communicate through media personalities, calling them on the social network sites. And I think that we can agree that some message would be more attractive than others if we compare a video directed towards youth, posted by the French Prime Minister, to other posts realized by people who are gathering willingly this particular community of young people. Whereas some media personalities have preferred to decline the government's proposal to communicate about COVID-19, not feeling legitimate to do so, others, even though feeling not more legitimate neither, have still accepted to communicate and produce posts to raise awareness about the COVID, saying that they were taking their responsibilities. And I found that extremely interesting because here we have people who could be considered as having a job that is kind of trivial, who would talk about responsibilities, wondering if they are legitimate or not to talk about COVID, when on another hand, we have found on many different media channels interviews of anybody willing to express their opinions, not facts, opinions about a virus and its consequences that are still not perfectly known yet. Where is the legitimacy here? Where is the responsibility in this situation? And again, what information, what message are we trying to send here? In the case of this media personality, for example, she chose, rather than trying to explain anything about the pandemic, to shoot a video within an hospital for 24 hours to show the reality of the field. As well, she gave the opportunity to her followers to ask all the questions they wanted to ask through her to an official representative of the state. This type of initiative could be a good way to reach a population that could be hard to reach within the actual situation and to raise their awareness. Of course, many people reproached her to step aside of her expertise. Yet, such initiative could be part of the tools to develop to help the population to adopt a preventive behavior. And indeed, options should be given to access and apply the information at different levels, because not everybody wants and need to understand fully a theory, to adhere to it, and to make sense about it. We need, however, to be able to provide enough details and enough information according to the level of literacy people would have with a full disclosure perspective. And nowadays, media could be an amazing opportunity to reach most of the people and a lot of different communities. As such, information should be provided in different forms, either by giving only the example and by producing a group effect and creating new norms in a kind of automatic way, either by explaining a little the importance of adopting a behavior while using different strategies to communicate about it, using humor, image, and so on. But in every case, we should be able to give the option to access validated and up-to-date information without hiding the limits of this information based on a relative knowledge that is here and now. And this option could be provided by different media, going from the most popular ones to the most intimate ones, knowingly the importance of our voices. So to come back to the purpose of this webinar and our initial question, are government and mass media on a level playing field when it comes to communicate? Of course not. But they both have different purposes, and they both have different expected responsibilities. One is challenging the other, and it could work in both ways, as media are challenging governments about their governance and decisions, and as government should challenge mass media to inform the population and to develop its knowledge based on accurate facts. Both are aware of their power over one another and are not afraid to use it, as we can see the bloodline between politics and media careers. But what about their powers over the general population? So to bring this presentation to an end, will government and mass media live happy ever after? I'm not sure, but within a public health perspective and population interest perspective, they should use one another for the better good. The human mind and logic is already naturally biased, as Patricia said previously. We do not need to create more confusion. So before ending this presentation, and while leaving you time to share your comments with me, I kind of wanted to share a video that I found extremely relevant to our case, and which I believe does not bring any ambiguity within the message that it intends to pass.